Welcome back to Breaking the Silence podcast, the podcast where we speak on things that people don't often talk about out loud. I am your host, Rochelle, and today I am joined by our co-host, Cassie, and we have a guest with us, which we're going to introduce a little later on. But before we begin today's conversation, I want you to imagine something. Imagine waking up one morning feeling completely like yourself. You're productive, you're motivated, you're patient with your children, you're showing up at work, you're answering messages, you're making plans, and life feels manageable. Then a week or two later, everything changes. Suddenly, you're overwhelmed by your emotions. Small inconveniences feel enormous. You start crying more. You're irritated by things that normally wouldn't bother you. You're now questioning your relationships. You're doubting yourself. You feel exhausted, anxious, hopeless, and disconnected from the person you know yourself to be. Then, just as suddenly as it arrived, it begins to lift. You start feeling like yourself again. You tell yourself, I'll be okay until it happens again next month and the month after that and the month after that. Now imagine living that cycle for years while being told you're overreacting. You're too emotional, you're too sensitive, you're too dramatic. Perhaps a phrase so many women hear all too often. It's just your hormones. For many women, these experiences are not simply mood swings. They're not character flaws, they're not weaknesses, they're not attention seeking. They are real, painful, and often misunderstood experiences that can impact every aspect of life. And that is exactly what we're talking about today.
So today's conversation is one that I believe so many people need to hear. Not just women, but parents, partners, siblings, friends, employers, and anyone who has ever looked at someone and thought they seem fine without even realizing the battle that the person may actually be fighting internally. So we're talking about depression and premenstrual dysphoric disorder, commonly known as PMDD. So, two conditions that are often misunderstood, minimized, or dismissed. Two conditions that can leave people feeling isolated, ashamed, confused, and exhausted. And yet, despite how common they are, many people spend years suffering before they receive answers.
Okay, so to help us unpack this important topic, today we're joined by someone who has helped many individuals better understand and navigate their mental health. Today we have Dr. Chevelle Westcarr joining us, and we're super excited for the conversation ahead. So, welcome, Dr. Westcarr.
Hi, everyone. Thank you for having me, and I hope I'm able to provide some useful insight to everyone today.
So, before we dive into today's discussion, we'd love for our listeners to get to know you a little bit better. So, can you tell us about yourself, your professional background, and what inspired you to pursue a career in mental health?
Okay, I'm a medical doctor who specializes in psychiatry. So, what that means is I provide mental health care, mainly medication management, and also providing some limited psychotherapy or therapy options. So I treat disorders from depression in young people to Alzheimer's in old people, or ADHD in children, ADHD in adults, whatever age group, whatever mental disorder, whether it's sleep, anxiety, bipolar disorder, those are the things that I treat. So I attended the University of the West Indies, where I completed my MBBS degree and Bachelor of Medical Sciences. And then I completed my psychiatry residency from the University of the West Indies as well. So those are my qualifications. And I currently work at the Spanish Town Hospital in Jamaica, where I also treat patients publicly.
Okay. Thank you so much, Dr. Westcarr, for sharing that. I always find it inspiring to hear the stories behind people's professions because, mental health work requires a special kind of compassion. It's
Right.
not just a career, it's often a calling, and we're so grateful to have your expertise with us today.
Yeah.
So let's really get into it. Let's begin with depression because it's a word that gets used so often. Yet I don't think many people fully understand what it actually means. People will say they're depressed because they had a bad day, because they're stressed, because something just didn't go their way. But clinical depression is much deeper than sadness. One thing that really stands out to me is how often depression hides behind functionality. I've met women who were running businesses while depressed. I've met mothers who never missed a school event while depressed. I've met people who looked perfectly fine on social media while privately questioning whether life is worth living. So, Dr. Westcott, why do you think so many people struggle to recognize depression when it doesn't look the way we've been taught it should?
It's how we're socialized. We're socialized to think that with depression you're not able to function at all. But the reality is that some persons who are living with depression, especially for a long time, and having a lot of caregiver burden, particularly in women, they find that they have to continue to show up. And so that can mask what depression actually looks like. So we don't tend to see on the outside what depressive symptoms somebody like that is having. But when they go home or when they have a moment to themselves, that's when you find that they're able to express or feel those types of emotions. So it's just how we're socialized to kind of mask those emotions. And sometimes
Mhm.
it's not until there's a crisis that we actually see what how severe or how bad it can get. But in milder cases, persons are able to kind of ride the waves and not be detected in their personal lives. But once it gets to a level of crisis,
Mhm.
then that's when we have to intervene, and it just presents more severely.
Okay, so are there stages to the depression cycle? Because I too went through depression. So does it start off mildly where you can still function, what they call functional depression, and then if you do not attend to it, then it gets worse, and that's when you become isolated and you feel like you cannot do the most simple tasks? Or
Yeah.
do they have people who go straight into the severe depression? Or does it phase?
So it can be something that brews over time, and I must say sorry that you had an experience with going through depression. I hope you're doing much better now.
I am,
It's something
thanks.
that great. It is something that can start very severe depending on the stressor that you're having. So say for instance your depression has been caused by somebody very dear to you passing away, then maybe you don't have time for it to brew, slow brew into from mild to moderate to severe, but immediately you find that you go into a severe depressive episode. If you have trauma over a long period of time, you may start off having mild depression until just gradually over time it brews into severe depression. So, in my experience, working in emergency units, psychiatric as a psychiatrist, a lot of persons will come in as emergencies when it's severe, but the history of how long they've been having symptoms is actually much years longer than they have decided to come in. And it's usually when their function is severely impaired, not able to go to work, their social function is impaired, they're not taking care of themselves, or they're unfortunately having thoughts of harming themselves, that they actually come in to get help. So it can go either way depending on what the trigger is, what the cause is for the depression.
Okay, thanks for the clarity.
So we're going to talk about the signs that people often miss. So one thing that I've learned is that depression doesn't always show up as sadness. Sometimes it shows up as irritability or exhaustion or anger, or sometimes it shows up as feeling emotionally numb. So what are some of the signs and symptoms that people commonly overlook?
I think you've listed some of them, but another one is sleep, having problems with sleep. So a lot of people won't associate depression with not being able to sleep or sleeping too much. When someone is having depression and they're sleeping a lot, people may say, "Oh, you're just lazy." But us Jamaicans and Caribbean people, once growing up in a Jamaican household, if it's a Saturday and you get up after 6 a.m., you're lazy, right? So sometimes when we see our children or family members being, more fatigued and sleeping a lot, that may be a sign that they're feeling depressed. Or if they're withdrawing from things that they don't usually like to do. So you have a child that usually watches TV, they love Power Rangers, and all of a sudden they don't want to watch Power Rangers anymore. That's a little sign that, maybe something is going wrong. So we call that anhedonia. So it's not just sadness, but also just not finding happiness or pleasure in things that you would have typically enjoyed. For an adult, it may be going out with your friends. No longer want to go to party with your friends or do anything of that nature. And so those are some of the signs that we may also miss. Also, difficulty with concentration. A lot of patients will come and say, I just can't focus on one thing, or I'm so easily distracted, and they think it's ADHD or something along those lines. But depression can actually change the way that the brain functions and your cognition, affects your memory, and those things we typically kind of overlook when thinking about depression.
I did want to know the difference between, like, how do you know that it's depression? So I'll give an example. I've never considered myself to be depressed ever. I've always thought of it as I had sad moments or times that I just wasn't in my mood to do certain things, or maybe I outgrew certain things. Um, but there was a point in my life where the people around me, even my mom, would ask me if I was depressed. And I think around that time I would stay home a lot and I would constantly be tired. But I didn't feel sad though. I just felt like I needed to rest constantly, right? And the people around me kept saying they think something is wrong. Like my mother asked me, but what's wrong with you? What's wrong? And I'll say, nothing is wrong. Like I feel fine. Like I don't understand. So it's almost like, how do you know the difference between you're just not in your mood, or you're just having a rough patch, or maybe you outgrew going out and you like to stay at your home, and if it's something actually wrong with you? Because I had a difficult time trying to figure out, you know, is that true, or I just need a vacation? Like, you know what I mean? It's like how do you know when to s- take it seriously and to actually seek help and start asking questions or to try to figure it out. Yeah.
Right. We were saying how do we know it's depression and not simple sadness? Right.
Like, how do you know the difference, and when to start seeking help if you feel like it's not, it
Mm.
might not be depression? Like, how
Yeah.
do you know for
So
sure?
the one way to know for sure is to seek professional help. As long as you think, you may be suffering from depression, especially if you're not having thoughts of hurting yourself, a general practitioner even can give you some insight as to whether or not what you're experiencing is actually depression, a major depressive episode. And then they'll be able to refer you to a psychiatrist. But once your function is being impaired, once you're having thoughts of harming yourself, those are definitely signs that you are suffering from some sort of depressive episode or some depressive disorder. So the main thing to look out for are impairments in your function, how long it's lasting. If it's just 2 days of you feeling
Mhm.
down, that's normal. Some people get sad from time to time, but we're not trying to confuse sadness with depression. because depression now is when we have a prolonged period of sadness, a prolonged period of loss of interest in doing things that you usually like to do, and that can be accompanied by functional impairment, whether it's with talking to your friends, going to work, taking care of yourself. And that usually lasts for at least a period of 2 weeks of you having those symptoms. So feeling down for a day or feeling down for two
Okay.
days doesn't mean that you have major depressive disorder or what you would call clinical depression.
Okay, so it's
Yeah.
The
the
length of
length of
time,
time. Okay, that's what I
yeah,
wanted to, yeah, that's what I wanted to pinpoint to know what specifically that I
yeah.
would need to look out for. Okay,
Yeah,
thank
and
you.
I can definitely relate to everything Dr. Westcar said because during my depressive episode, my severe depressive episode, because I mean there were times where I would have sad days, as Dr. Westcar said, but during my severe depressive episode, it it lasted for about a month to 2 months, and I felt completely crippled for lack of a better word. Like even if I wanted to do the thing, I just couldn't get myself to do it, the task. It was so frustrating. I would wake up in the morning and I would feel like, what am I really doing here? Like, what is my purpose? I slept a lot just to escape the thoughts and the feelings. I had no appetite. I was very irritable. I didn't want to speak to anybody. I isolated. I didn't answer calls. It got really bad. So for somebody currently experiencing those symptoms, even though not so severe, what would be your advice to them in terms of like what options are available for them? Um, I know you said that you can go and seek professional help, but a lot of persons, especially in the Caribbean, they that is not easily accessible because it tends to be very costly. So apart from professional help, what advice would you give that person?
So when you're in a state of depression, moderate to severe, it can be very hard to get up on your own and seek help because we you get in kind of like a vegetative state where everything feels like a burden, you're not motivated to do anything, it's difficult to start and complete tasks. But definitely what I would say is reach out to somebody that you can trust, reach out to somebody that you know will be understanding or believe will be understanding of the condition that you're in and try to build a community around you. That's the first thing that I would recommend you do. But also share how you're feeling with those people so that if it gets to a point where things are getting to to an emergency or an urgent situation, they're able to intervene. We also have different lifestyle changes that you can make. But as I said, it's easier said than done because when somebody, as you mentioned, when somebody is severely depressed, it's hard to even get up and brush your teeth. Something as simple as getting up, brushing your teeth, going to take a shower,
Take a
that becomes
shower.
difficult. But definitely how you eat,
Right.
that's hard as well because the appetite can decrease in depression or it can increase and you start stress eating a lot of ice cream and junk food, junk in, junk out. So you'll feel as bad as the food that you eat. So it's kind of difficult. So we need that community around you to help to push you. So if you are in bed just not feeling like getting up and doing anything, have a family member there to say, hey, let's go for a walk. Because simply going for a walk can do wonders for your mental health. Just having the sun shine on you is does wonders for your mental health. So get up in the morning, just go outside if you have a balcony, if you have a terrace, if you have a veranda, whatever it is. Something as simple as sitting in the sun can can lighten your mood. Putting a smile on your face can lighten your mood. That's something that we call the facial feedback theory. So those are things in our immediate environment that you can use. We all have access to the sun. We all, well, most of us can smile unless you have some neurological condition, and most of us can find at least
Hmm.
one person that you can go to and say, "Hey, I'm feeling this way. Until I can get professional help, can you, and give me some encouragement. Walk with me, take me to the gym, bring me some food, some healthy food, not junk food, some healthy food. Because right now you may feel like in the depressive episode, all you want is ice cream or you don't want anything at all, or chocolate or you don't want anything at all. So you want someone there that's able to guide you along the way, because in that state, your judgment may be off as well, and the sort of hopelessness that you feel kind of determines or pushes certain decisions that you make. You may not be able to make the best decisions for yourself.
Okay. I do want to ask Rochelle, when Dr. Westcar was saying like talk to somebody, find a support system. I remembered you said that you couldn't even do that. Like you couldn't even bring yourself to talk to anybody. So it seems like a cycle of the things you have to do to try to get out of it. You cannot even start it, which sounds horrible. Like it sounds tough and it sounds horrible. So I want to know from Rochelle, I want to know whilst you're going through that cycle, like what was it that made you like get out of it? Like what was how did you bring yourself to get the help when you were already in the mood of not being able to get up and not being able to talk to anybody? Like what where did you get the strength from whilst you were in that mindset?
Before I even get to your question, I just want to say sometimes it's very difficult to express to persons how you're feeling in the moment. Because somebody who has not gone through depression, they would look at you and be like, oh, you're just sad. It will pass. Or you're overreacting. You're being dramatic. But to answer your question, I avoided professional help for a long time because I thought it would have gotten better. But when I realized like nothing was changing and my life was basically on pause, my job was at stake because I was not performing at my at my optimum. Persons were starting to, ask questions, why is this not getting done? And I know this is not who Rochelle is. Rochelle is the one outside in the living room speaking to everybody, and Rochelle was confined to a room for months. So I said, no, I have to take the step and seek the professional help that I need. So what I did, I reached out to a therapist that I saw on Instagram, and we had our first session. After about 3 sessions, I still did not feel any better. So she recommended that I see a psychiatrist, and he prescribed antidepressants, sorry, among some other medications, sleeping medication, anxiety medication, and so on. And it's from there I started to feel better. And yes, there were periods where I fell back into that depressive state, but I was in a better position to deal with it the second time around. So I did not stay in that cycle as long as I did the first time. So
Okay.
it all starts with you wanting better for yourself.
Just to add as well,
Okay. So you just have to push through.
just to add
Okay.
You're
as
right.
well, another important thing that you can do is find something that grounds you to this earth. Find something that motivates you. If it's your mom, if it's your job, if it's a certain career that you want to achieve or a certain goal that you want to achieve, if it's I had an emotional support animal. Like when I had rough days at work or at school, I'd come home to my dog and I feel better. So, just hold
Oh,
on to something
nice.
positive, and help that thing will help
Mm.
to keep you grounded and help guide your decisions towards the right direction.
Mm. And I just want to say, and I want to stress on that persons who have never gone through depression, be a little more compassionate to those who are going through it. You may not understand the depth of it, but be the best person that you can to that person. Support them in whatever way that you think will help them get better. Or sometimes they just need somebody to listen to them, not fix them, but just, give them that time, create that safe space for them. That goes a long way, trust me,
I
it
think
does.
what we should ask
I understand
I
what you're
think what we should
saying.
ask, or if I can give some advice to a friend that may have a friend or family member that's going through a depressive episode is ask, what do you want from me right now? How can I help you? Who do you want me to be for you right now? Because sometimes the person is coming to you just simply to get a weight, a burden off their chest to say, oh my gosh, I'm going through this. They don't want somebody to come with, this is what you need to do, and you need to do this. They just want to have that space to talk to somebody. So you find
Mm.
out whether they want you to be the person who is finding solutions right now, or if they just want a listening ear. So it's not what you think the person wants. It's what they need for their recovery and what they need to feel better in that moment. The other things can happen as well behind the scenes because clearly the person will need professional assistance that a layman cannot provide. But within your scope as a friend or family member, find out what they need from you in that moment at that time. So you're not adding to the distress that they're feeling.
Can I speak on it as the person who has been on the side of not understanding what's happening? So I have been there where I've had family members who have been depressed, and I understand everything that you're saying, and that's what I'm doing now. But I feel like it can be a lot of pressure sometimes, because it's almost like you don't know what to do, or you feel helpless. You don't know, like you I cannot explain it. It's a helplessness when it comes to that other person, where you want to help, but then you feel like, okay, it sometimes feels like they don't want the help, and then you start to wonder, am I doing more harm by trying to help? Then you start to, like, it just gets out of control with the thoughts and figuring out what's the right thing to do, because I understand you're saying be there for them, listen, but some of them, everybody's different, and some of them, the way they react is they would push you away, right? So it's like you don't know if you're supposed to let it happen or if you're supposed to come back. Like, it's like it's situational, I guess. So it can be very confusing, especially the fact that we come from a culture. Well, for me, I come growing up, I have to be honest, and it may sound like a bad thing, but this is breaking the silence where we talk about things that people don't normally talk about, right? I was made to think, and when I say I was made to think, there is not one person telling me this. I mean, my environment, the things happening around me, the people I knew, things I watched on TV. I was kind of, there was a point in my life, it felt like depression wasn't a thing. Like, it wasn't, you understand what I'm saying? So imagine you're growing up and everything that's happening around you is kind of programming you to think that that's not a real thing, or maybe the people are too sensitive, or maybe, and it's a cultural thing. You all know Caribbean people already. Don't cry there. What you like, So it's like kind of groom you to feel like, oh, you just, what you crying for? Like that, not like, it's not a real thing, and it's not something to take seriously. And so when as I grew up, of course I realized I was taught the wrong thing. Not taught, I don't want to say taught because it sounds like a specific person taught me. No. I just mean that having those thoughts or growing up thinking that was wrong. It is actually real. It's an actual condition, and people are really suffering from this. And then when I realized that and I actually met people who were going through it, my heart broke for them, because I cannot imagine feeling that horrible or that low for months. Every time you awake, it sounds horrible. Like, it sounds like you're suffering. It actually made me feel like it might be even worse than physical pain, because let's say you get a scratch or you hurt your arm, you take a Panadol, you feel better. You can't take a Panadol for you get what I'm saying? And I'm sure, Rochelle, your medication helps and stuff, but I'm sure it's still something you have to maintain and you have to battle with for years to come. So yes, people who do not understand depression, I agree. We need to be much more understanding. We need to give grace. We need to do research. We need to listen to Dr. Westcarr. We need to listen to professionals who could give us information so we can understand. And but I also want you guys to know there are times where I'm still not sure what to do. I have to be honest about it. There are times where I still feel confused and it feels like a lot of pressure to be the one that maybe the person is coming to, and you're like, okay, I'm doing what Dr. Westcar said, but it's not working. Should I keep talking? Should I not? Like it can be a little, like I just wanted to give that other perspective of experiences that I've had with that kind of situation. But I feel like I'm in a much better place just because of what I'm doing now. I'm actually diving into it to immersing myself into it to get a much fuller
Right.
understanding, you know.
So what
Um,
you're
but yeah, I just wanted to give that
what you're
perspective.
describing is quite understandable, and it's what we call caregiver burnout. So you have somebody with a mental illness, not just depression, but also people who have psychotic disorders where they may become violent or they may, withdraw themselves from others or have delusions. Family members can sometimes feel stressed or burnt out from having that duty of care. So it's quite understandable that you feel that way, but that's why the professionals are there. The support system from the family for somebody who has moderate or severe depression can only go so far, and that's what we're there for. So if you are having any difficulties in, how to get through to that person, we're there to guide you, we're there to help you to, find a way to get through to them, especially with the therapists. So it's understandable that you feel that way. You're only human. You're not trained in dealing with things like this. That's why we have a whole cadre of professionals that deal with mental illnesses. So it's not a selfish way of thinking or anything particularly wrong with you or anyone else who has those thoughts, because it takes more than just family support. It takes a team to deal with moderate and severe depression.
Yeah. Well, what I just learned from you right now is that it's not just for the actual person experiencing depression, it's for their support system too.
Yes,
So I'm just realizing that I didn't think
yes,
of that before. I always thought about it's for the specific person who needs the help and who's actually going through it. I'm now realizing it's not just for that person, seeking help. It's also
right,
available for the people
right.
affected or the people
Yeah.
around or supporting.
So we do have
So
support groups in Jamaica
yeah,
for
that's
persons who have family members that have mental illnesses. There's one particular one called Mensana. So they have group meetings every now and again, probably once a month, where they'll talk about their stressors related to dealing with somebody in their family who has a mental illness, and that type of camaraderie kind of helps the family themselves find ways to deal with or learn from how this person is dealing with that situation, that person is dealing with that situation. They come together and they're able to pool together and try to support each other in that way.
in
It
person?
used to be in person.
Oh,
I'm not sure if it's in person again, but they were doing it online since the pandemic.
okay. And is it open to persons outside
I'd
of
have to find
Jamaica?
out. I'm not 100% certain. But I've referred quite a few people there,
Okay.
and they've had good experiences with it because the family does need support as well. You cannot pour from an empty cup.
so let's talk about PMDD. So I feel like many women hear the term for the first time. I know I only heard the term maybe a couple months before this conversation, and I'm 35. That's a long time living and not knowing about it. For years, they've been told they're moody, they're difficult, they're too sensitive, or they're too much. And then they discover that they're experiencing something that may actually be a recognized medical condition. So, for all the people out there who may be experiencing it, Can you explain what PMDD is and how it's different from PMS?
So PMDD is something that happens to women before their periods, where they can have different changes in their mood. So it can be depression, irritability, lability, where they go from being happy to sad, and we call that mood swings. And this is because of a difference in sensitivity to certain hormonal changes during the menstrual cycle. So PMDD is something that you can track with the menstrual cycle. So, say a week to 2 weeks before your periods, that's when the symptoms usually start. They're not just they're more severe than what you would find with premenstrual symptoms. With premenstrual symptoms, you feel a little sad, yes, but you can still go to work, you can still interact well with others. With PMDD, it's a more severe presentation of that. It's more predictable in terms of when you track it on a calendar, whether it's your flow app or whatever the case may be, you find that every month at this point, whether it's 14 days before the period, 10 days before the period, you have these symptoms and they continue and then gradually improve as the period progresses and then you start feeling more like yourself.
So have you worked with women who spent years believing something was wrong with them before finally discovering PMDD?
I've dealt with a lot of women who maybe they also have another diagnosis, another mental condition, and the PMDD makes it worse. And they say, oh, they may reach out to me in that period where it's 1 week or 2 weeks before their period and the symptoms are quite extreme at that point. And when we track it, we're like, okay, your period is coming in 1 to 2 weeks. If we
Mm,
do a cycle, if we track this, it's actually predictable that every month at this time you do have these symptoms, and it kind of validifies what they're experiencing, because women are told, oh, you're just hormonal, you're miserable, and oh, she's on her period. But this is a real hormonal issue that women have, and it can be something that occurs on its own, or it
mm.
can be something that worsens your underlying depression or other mood disorders. So you may find that if you had bipolar disorder before, or depression before, or anxiety before, it gets worse 1 week to 2 weeks before you actually start your menstrual cycle.
Okay, so is it something that is just about the mood, or is it something that's also about severe pain? Because I've had friends and colleagues who sometimes when they get their period, they are in so much pain and they are so it's like they can't go to work or school or like they're suffering. So is it just about the mood or is it also about the physical pain that they're experiencing?
So PMDD is about your mood, not the physical pain. So if you're having that severe pain in your periods, it's worth getting that checked with a gynecologist. But the dysfunction that you experience in PMDD is primarily related to your mood. Not saying that being in pain can't make you feel depressed or sad, because persons with chronic pain can develop depression. We're looking into how women with endometriosis and have chronic pelvic pain can develop major depressive disorders. So, it can precipitate depressive symptoms, but that's not the core of PMDD. The core of PMDD is a dysregulation that happens because of your sensitivity to the hormonal changes. So it can occur with or without pain. And pain is not something that's necessary to make the diagnosis. It's more dealing with your mood.
Okay, I was going to ask, since it's just about the mood, how do you know that it's actually PMDD or it's a different disorder that affects the mood, something, maybe not depression, but something else, right? Like what what is the specific thing that would trigger you to know that it's actually
The
PMDD?
specific thing is a clear, you must have a clear pattern of these symptoms happening month after month around the same time of your menstrual cycle, and they have to resolve as your menstrual cycle um, goes to the end, right? So if you had another mental disorder, it wouldn't have any relation with your period if that is what's primarily causing it. Whether you're in your luteal phase or your follicular phase, you would still have the same symptoms. But it wouldn't occur at the same severity, the same intensity, at the same time of the month or the same phase in the menstrual cycle. So that's really what we're looking for. We're looking for a clear pattern of the symptoms emerging in a particular phase of the menstrual cycle, which is the luteal phase, 1 to 2 weeks before the menstrual cycle begins, with improvement as the menses end.
Westcarr, what treatment options are available for somebody suffering with PMDD? And once they start that treatment, is it something that will continue throughout their life? So they have to stay on, whether it be medication or whatever, throughout their life, or does it improve over time and you can get off the medication eventually?
So we have different treatment options available. For persons with milder PMDD, you can do psychotherapy, so talk to a therapist around that time. Get some grounding techniques to help you go through the moods and help you better manage them,
Mm,
help you better cope with them. Another option is medication. So we can either give you medication, which are antidepressants or mood stabilizers, but primarily antidepressants. Give them to you either every day, or we can start it a little bit before we expect the symptoms to begin. And you only take the medication for 2 weeks out of the month or 3 weeks out of the month, and then you have a week off. I prefer to prescribe the medication continuously because
mm,
coming on and coming off, it can be a bit confusing. So
right.
you can use an antidepressant to treat it. Therapy is always something that I push for. So if we're using medication, we're also gonna do therapy because I don't like giving patients a life sentence with medication. I think we can learn to navigate some of our feelings without medication. So we do recommend treatment for a particular period of time, depending on how severe the case is. But eventually, the aim is that we can come off or taper off or go to the lowest dose of medication possible.
Okay.
Dr. Wesker, you mentioned therapy and antidepressants. Earlier, you were talking about diet. So does that also play a part? So let's say I'm having these issues and I go to my doctor or therapist. Would they also bring diet into the conversation where they're asking what I eat and they're telling me I should eat more of this or more of that? And aside from diet, is there anything else that they would bring up that maybe needs to be modified?
So, whether it's physical health or mental health, whatever mental illness or physical illness that you have, but particularly speaking about PMDD and depressive disorders, diet and exercise are integral. So those are the pearls of improvement because what you put into your body will help you to recover, right? So natural ways of building your endorphins, going for a walk, going for a run, those things are essential. And what we're looking into now is the Mediterranean diet. We find that that diet is better for persons who not only have physical conditions like high blood pressure or high blood sugar, but also persons with mental illness. The Mediterranean diet has been found to be really helpful in supplementing just your overall lifestyle and overall care. And we also usually do certain blood tests whenever we diagnose somebody with depression. So in my practice, for example, I'll check your vitamin B levels, your folic acid levels, your vitamin D levels, and then we can supplement those particular vitamins if we find that they're low. So if vitamin B level is low, we can either try to increase the amount in your diet, or we can use a supplement, whatever it is that you can accommodate.
One thing people don't always understand is how conditions like depression and PMDD affect every area of a person's life. So it will affect marriages, parenting, friendships, careers, and self-esteem. So, Dr. Wester, can you talk about some of those impacts?
So particularly speaking to career, I'm a firm believer in menstrual leave. I feel like we can get a little 1 day or a little 2 day,
I
but
know, right?
you know, yeah, yeah. So it does affect your occupation and how you function at work. It can be hard for you to push through the physical aspect of it, and then the mental aspect. So yeah, we do see that it does affect those relationships at work, and people may call you names, and people say you're miserable and this, but you're actually having a real mental
Mm,
illness, right?
right.
Also at home, you may become more short-tempered, and boy, everybody kind of afraid to come around you, or you know. So there are real life impacts in terms of relationships and work. um but the key is to have people around you that are supportive, and try as best as possible to not to be non-judgmental, because you never know what the person is really going through.
Yeah,
Exactly.
I feel
Yeah.
like with work it's a hard one because in all the spaces that I've worked, there has always been at least one woman who had a really bad experience every time her period comes. And for some reason, and I'm not just talking about the staff, the people that the manager that she would tell, I really cannot come in today, I'm not feeling well. Why is that not taught in the workplace? Like, why is there this culture in the workplace where they disregard when you say you're suffering, and you need the day, that you get so much trouble to get your day and you're feeling horrible,
Yeah,
even in general, with um everybody knows women get their period every month, so why it's almost like it's ignored sometimes,
yeah,
you know what I mean?
It's women who treat other women that way. When you go, your menstrual cycle might not be as bad as the other person, but you should be more understanding. And I just don't get it. Like, why? Why be so, you know, rude, or I just
yeah.
don't get it. Like,
It's a lack of empathy within the
mm,
workplace. It's not just with the menstrual cycle, but just being sick in general. People sometimes question and not willing to give time off.
it's sad.
It is sad, and I feel like we have to sometimes this is what I see. Put yourself in the other person's shoes.
Right.
If this person is sitting there, not only are they in pain, their hormones are all over the place. They feel horrible. How do you expect this person sitting there to provide the same level of work that a man who's not feeling any of those things is producing right now? It I'm just being honest, guys. I don't know if it's coming across bad, but it's the truth. Like, is it
Yeah, it
not?
is.
Am I crazy for thinking that? Like, how would you not be like, okay, I understand today or this week may not be her
Mm,
best. Like, why is there no space in the brain to get that? I don't It's very baffling to me.
yeah,
You
it
have
is.
you have to care for yourself. That's where it starts. So if you find that you need the time, ask for the time, request the time off, or go slower that week. Because if you depend on others or your boss to say, okay, don't go too hard today, you're going to overwork yourself and burn yourself out. So you have to look out for yourself as well. Because other they just want their targets met at the end of the day. They don't care if you drop down, they'll replace you in a second. So you
Yeah,
have to
but
also take care of yourself.
But Dr. Westcar, I feel like some people don't feel like they have the luxury to to look after themselves and make the decision they know that's right for themselves, because if they do that and they possibly lose the job because they're needing a day, an extra day or whatever, then to them their whole life will fall apart. So they feel almost forced to stay in it because they feel like they don't have a choice, you know?
Yeah.
So it's just a cycle, and this is why we're having these discussions, is to, you know,
Mm-hmm.
bring awareness to it and figure out ways to make things better, you know?
Yeah, yeah. It's case
Definitely.
specific. I do understand not every woman has that luxury, and sick days or taking a day off may be used against you in certain careers. So it's tricky. It's tricky. But just try to make your space, your internal space and your home a sanctuary for yourself, and leave
Ye-
all that where it belongs or doesn't belong, because we shouldn't be experiencing that. But try to create a sanctuary of inner peace within yourself and a safe space at home or wherever the case may be.
Well
Yeah.
said. I
And
like
I under
that.
and I understand as much as we need to take care of ourselves as women, but I still feel like on the employer's part, they need to be more supportive because that's a natural part of life that women go through. Like they need to have some sort of legislation passed that the woman gets a day or two off of work during that time and find another way to make up for those 2 days lost when she is, feeling much better and she can produce better results. Because what is the point of being at work during your downtime and you can only give up 10% when you can, you know, make up for that on the other 2 days that you decide to work and give off 80 or 90%. Like it just doesn't make sense. And I feel like for far too long we've been accepting of that, and we as women we need to stand up for ourselves and say no, this and personally, if I, it doesn't matter what the employer says, according to Cassie, it may sound that I'm coming up a little harsh. It doesn't matter what the employer says, but at the end of the day, you have to prioritize yourself, your health, and your well-being. So if you need to stay home, you stay home on that day and then you deal with the consequences after. Maybe that job was just not meant for you. As simple
Well,
as
that's
that.
your opinion, eh, Rochelle? Because you don't want to tell some people that and they do that and they lose
No,
their job, and then it's your fault because you tell
but it's
them
it's
to
it's
stay at
your
their
Like
choice.
home.
It's
Rochelle
you.
said,
It's your
not to go
choice.
to work.
It's your choice to make, right? But I'm saying that we need to prioritize ourselves because if we don't take care of ourselves, Cassie, when you fall sick or you fall ill, you are replaceable. Like right here and there, they're getting somebody to replace you. So put yourself first. Trust me, God will make a way. He always does, and He will make a way. I mean, if you have the capacity or you have the ability to go in, maybe you cannot give the 80, but you can give 60,
Yeah.
70, then go. But if you're at 10%, don't drag yourself to work. It doesn't make sense. If you need a formal sick leave, go see a doctor. So that way the employer cannot hold that against you. You have a sick leave to say you're not well. And I mean
Right.
you probably cannot do that every month, but when you've done it several times, they will get the point. And if they feel like you're taking away from their productivity, then it means that probably you need to get another job.
Larger scale than that, I think as people, we just need to have more empathy, have more understanding, and create spaces where people can rest when they need to. People don't
Yeah.
have to feel guilty, because the theme we hear in everything Rochelle said, what I said, is guilt. Is that a lot of women, they would feel guilty because you have to stay home because you're not feeling well, but the whole time you're thinking about work, what's happening, what they're doing, what they're saying, what, like, you know what I mean? And even not even just work, even after arguments, even after snapping at people, even after withdrawing from your partner, even after missing your deadlines, you know. So it's guilt is a recurring theme, and I feel like it's something that people need to be able to, they need help to be able to navigate, not feeling guilty for doing what you need to do to make sure you're well. You
Mm,
know,
Yeah,
yeah.
yeah.
um, I feel like there should be steps on instruction manual or something. How do we not feel guilty for showing up for ourselves and not feeling
Mm.
like we're selfish or anything like that?
It
I love
starts
how
with
you
us.
put that.
It starts with us, and it starts with us having these conversations and opening the floor up to other women to share their
Right.
experiences, you know,
Mm.
because without it, if it's not talked about, then it's a non-factor and nobody will discuss it. There are a few countries I've seen implement this idea of a menstrual leave now, and I
Right.
it's really commendable because there are so many illnesses that come around with your
Mm.
menses, endometriosis, PCOS. In those times, it's very difficult on women. So it's something that we should also look into in the Caribbean, and I think it's coming. I'm hopeful that it's coming.
I pray that it is
Amen.
coming
Yeah,
because
Mm-hmm.
a lot of us women, we will speak among our friend groups, our family members, but we don't speak up to the person that can actually make the changes. You can speak up and be respectful. I tell Cassie that all the time. We shy away from it. We sit back, we complain, oh, I have a tummy ache, I have cramps, I have this, but what are you doing? You have to go and have a conversation with your employer and see how y'all can make things work. I'm sure
yeah,
there can be a solution where both
yep,
parties can win. And that's why we created that space to speak on things that people are often afraid to speak about because these are real life issues that we're dealing with.
yeah.
Okay. So before we close today's conversation, I want you to picture a woman listening right now. Maybe she's sitting in her car because it's the only place she can be alone. Maybe she's listening while folding laundry. Maybe she's lying awake at night wondering why she feels the way she does. Maybe she's exhausted from pretending that she's okay. Maybe she's spent years believing she's broken. Or maybe she's been called dramatic, too emotional, too sensitive, or too much. Maybe she's convinced herself that if she just tried harder, prayed harder, smiled more, or pushed through a little longer, things would get better. But today she's hearing words that sound familiar. Today she's wondering if what she's experiencing actually has a name. Today she's wondering if she's not weak after all. If she's not failing, if she's not alone. Dr. Westcar, what would you want to say directly to her?
First of all, I would say you're definitely not weak. Women are powerful. Uh, I would say, there's help out there for you. You're not miserable. You're not a nag. You're not, none of those words describe you. It's possible that you do have something that we have a full list of criteria for and some sort of explanation for why it happens. And so I think what's integral is seeking support in those around you, seeking support within yourself, doing an audit of your life and seeing what things bring me joy, what can I change to make me feel better around these times. And if it is that you've tried making those changes and it's not working, then you can seek help from a psychologist or a psychiatrist, because you don't have to suffer every month. You really don't have
Mm,
to. There's help out there. If one thing doesn't work, we can try something else. But there is a solution, and suffering is in this day and age, it's optional.
mm,
We just need to get the right care and the proper access. And access is one of the biggest hurdles right now, but it's really something that it hurts my heart to know that women are suffering from depression and they don't know where to get help, or they don't know that help is actually available. So I would say help is out there. Seek help from within and also from professionals.
That was incredibly powerful. And, I agree with you saying that it doesn't mean that women are weak. Um, so I just want to thank you so much, Dr. Westcar, for joining us and helping us navigate this conversation and bring awareness to something that affects so many people, and so many people may still not fully understand or know about yet, So I just want to thank you for that.
Thank you for having me. It's my pleasure to share.
Who is listening today, I want you to remember this. You are not broken, you are not weak, and you are not imagining your symptoms. And most importantly, you do not have to suffer in silence. So thank you for joining us for another episode of Breaking the Silence. Until next time, take care of yourselves. Bye.